Cardiac pulmonary resuscitation, CPR introduction. C. Cardio heart. Push hard and fast on the center of the victim's chest. P. Pulmonary lungs for airway. Tilt the victim head back and lift the chin to open the airway. A. Resuscitation. Recover/revitalize for breathing. Give mouth-to-mouth rescue breaths. Cardiovascular emergencies. Any condition that affects respiration reduces ability to deliver oxygen. Severe bleeding, shock, stroke, heart conditions. It is during those critical minutes that CPR can provide oxygenated blood to the victim's brain and heart, dramatically increasing his chance of survival. It is a life-saving technique useful in many emergencies, including heart attack and near drowning, in which someone's breathing or heartbeat has been stopped. CPR combines rescue breathing and chest compression. It provides oxygen to the brain until advanced cardiac life support arrives. Definition. CPR is a technique of basic life support for oxygenating the brain and heart until appropriate. Definitive medical treatment can restore normal heart and ventilatory action. CPR can support a small amount of blood flow to the heart and brain to take time until normal heart function is restored. CPR is a technique of basic life support for the purpose of oxygenation to the heart, lungs and brain until and unless the appropriate medical treatments can come and restored normal cardiopulmonary function. CPR is a series of steps used to establish artificial ventilation and circulation in the patient who is not breathing and has no pulse. CPR is basic emergency procedure for life support consisting of artificial respiration and the manual external cardiac massage. Purposes: to maintain an open and clear airway. A. To maintain breathing by external ventilation. B. To maintain blood circulation by external cardiac massage. C. To save life of the patient. To provide basic life support till medical and advanced life support arrives. Restore cardiopulmonary functioning. Prevents irreversible brain damage from anoxia. To establish effective ventilation and circulation. Risk factors: cigarette smoking, hypertension, high blood cholesterol, high fat, cholesterol. Diet. Indication: cardiac arrest, ventricular fibrillation, VF, ventricular tachycardia, VT. Asystole, pulseless electrical activity. Respiratory arrest which may result from drowning, stroke, foreign body and throat, smoke inhalation, drug overuse, suffocation, accident, injury, coma, epiglottis paralysis. Cardiac arrest, it is loss of cardiac function, breathing and loss of consciousness. Symptoms include absence of pulse on carotid artery. Respiration arrest may be within 30 seconds after cardiac arrest, enlargement of pupils which may be in 90 seconds after cardiac arrest. Respiratory arrest. Types of CPR. 1. BLS, basic life support. It is a sequence of procedures performed to restore the circulation of oxygenated blood after a sudden pulmonary of cardiac arrest. Chest compressions and pulmonary ventilation performed by anyone who knows how to do it, anywhere, immediately, without any equipment. Aim: to ensure open airway and adequate ventilation to maintain circulation until help comes and definite treatment with advanced life support can be administered. To ALS, advanced life support, airway secured with advanced technology. Breathing is maintained with some means of breathing apparatus. Circulation is maintained by BLS along with intravenous access defibrillator. Appropriate drugs. Principles of CPR to restore effective circulation and ventilation to prevent irreversible cerebral damage due to anoxia. When the heart fails to maintain the cerebral circulation for approximately 4 minutes, the brain may suffer irreversible damage. Prior to CPR. Basic life support, BLS, position the patient. Ensure airway breathing circulation. Basic life support consists of airway management, artificial ventilation, external chest compression. Advantages: helps to provide continuous supply of oxygenated blood to the brain and heart, avoids irreversible damage to the victim. Basic life support. D equals danger. R equals responsive. S equals send for help. A equals open airway. B equals normal breathing. C equals start CPR. D equals attach defibrillator. Continue CPR until responsiveness or normal breathing return. How CPR works: the air we breathe in travels to a lung where oxygen is picked up by our blood and then pumped by the heart to the tissue and organs. When a person experiences cardiac arrest, whether due to heart failure in adults, for the elderly, or an injury such as near drowning or severe trauma in a child, the heart goes from a normal arrhythmic pattern called ventricular fibrillation and eventually ceases to beat altogether. This prevents oxygen from circulating throughout the body, rapidly killing cells and tissues. In essence, cardiopulmonary resuscitation serves as an artificial heartbeat and an artificial respirator. CPR may not save the victim even when performed properly, but it started within 4 minutes of cardiac arrest and defibrillation is provided within 10 minutes. A person has a 40% chance of survival. Equipment's a flat hard surface. No additional equipment is necessary, but in hospital setting, an emergency crash guard with defibrillator and cardiac monitor should be brought to the bedside. A crash cart contains airway equipment, suction equipment, intravenous equipment, laboratory tubes and syringes, pre-packed medication for advanced life support phases of cardiopulmonary resuscitation. Phase 1 Basic life support. C equals circulation, BLS is life support without the use of special equipment. Phase 2 Advanced cardiac support. D equals drugs, E equals ECG, F equals fibrillation. It is life support with the use of special equipment like airway, endotracheal tube, defibrillator. Phase 3 Prolonged support. Post-resuscitation care. CPR procedure, sequence of operations: chest compression and pulmonary ventilation performed by anyone who knows how to do it, anywhere, immediately without any other equipment. Check for responsiveness of victim. If you suspect that victim has sustained spinal or neck injury, do not shake or move him. Approach safety check. Response, responsiveness: tap the shoulder and shout, "Are you okay?" Circulation assessment: established presence or absence of carotid pulse by placing 2 fingertips on his carotid artery for 5-10 seconds. Shout for help. Open airway, head tilt plus chin lift method, jaw thrust method. Check breathing, listen for normal, feel, look for breathing, no longer than 10 seconds. Place ear over the victim's chest and stomach. Watch to see if the victim chest is raising. Breathing: if the victim is not breathing, give 2 breaths 1 second or longer. Pinch the nostrils closed with the thumb and index finger of the hand that is on the forehead. Take a deep breath, open mouth while. Place it outside of the victim's mouth, making a tight seal. Seal the mouth with yours. If the first 2 don't go in, reset and give 2 more breaths. If breaths still do not go in, suspect choking, mouth-to-mouth barrier. Devices are masks, shields. Inflate the victim's lungs by 2 full breaths, each breath over 1 second, allowing the victim lungs to relax. If resistance is experienced, then we check airways. Call 108-30. Chest compression. After greeting is given, locate proper hand position for chest compressions. Place heel of one hand on center of chest between the nipples. Place the heel of one hand in the center of the chest. Place other hand on top. Interlock fingers. Keep elbow straight and position shoulders directly above hands. Compress the chest at 100 per minute using both hands. Give 30 chest compressions. Count 1 2 3 4. Depth of compression 2 inches or 5 centimeters. -2. Rescue breaths. Pinch the nose. Take a normal breath. Place lips over the mouth. Blow until the chest rises. Take about 1 second. Allow chest to fall. Repeat. Recommendation: tidal volume 500 to 600 milliliters. Respiratory rate: give each breath over about 1 second with enough volume to make the victims rise. Chest compression at 100 minute per minute. While performing compressions, elbows should be locked and push straight down. Continue CPR or 6 Cs. 1. Check responsiveness. 2. Call for help. 3. Correctly place the victim and ensure the open airway. Assess for any visible obstruction in the airway. Clear airway by removing any loose obstruction like mucus, blood, foreign body from mouth and pharynx. In case of unconsciousness victim, tongue is the most common cause of airway obstruction. If the victim is still not breathing, then open airway by head tilt and chin lift or jaw thrust method. Note: jaw thrust is a technique used on patients with a suspected spinal injury and is used on a supine patient. If the victim is still not breathing on his own after the airway has been opened, you will have to assist him breathing. 4. Check the presence of spontaneous respiration. 5. Check pulse. 6. Start external cardiac massage and artificial ventilation, or 1. Unresponsive, no breathing or no normal breathing, only gassing. 2. Activate emergency response system GID, defibrillator. 3. Check pulse. Define pulse within 10 seconds. Define pulse. Give 1 breath every 5-6 seconds. 4. Begin cycles of 30 compressions in 2 breaths. 5. Defibrillator arrives. 6. Check rhythm. Shockable rhythm. 7. If shockable, give 1 shock. Resume CPR immediately for 2 minutes. 8. If non-shockable, resume CPR immediately for 2 minutes. Check rhythm every 2 minutes. Continue until ALS providers take over or victim starts to move. Recheck pulse every 2 minutes. Note for high-quality CPR rate at least 100, minute compression depth at least 2 inches, 5 centimeters. Allow complete chest recoil after each compression. Minimize interruptions in chest compressions. Avoid excessive ventilation. Hands positioning. Hands in the center of the chest, lower half of breastbone. Second hand on top of the first, not on lowest part of breastbone. Applies to both lay and health worker providers. Main stages of CPR: ABCD format. A equals airway, B equals breathing, C equals circulation, D equals defibrillator. Guidelines for termination of resuscitation: return of spontaneous circulation, arrival of arrest team or medical help. If the rescuer becomes exhausted when death is confirmed, do not move the victim until CPR is given and qualified help arrives. Threat of fire/explosion: victim must be on hard surface. Place victim level or head slightly lower than body. All body parts rolled over at the same time. Always be aware of head and spinal cord injuries. Support neck and spinal column. WHY CPR may fail. Delay in starting, improper procedure. Example: forgets to pinch nose. No ACLS follow-up and delay in defibrillation. Possible complications: coronary vessel injury, diaphragm injury, hemopericardium, hemothorax interference with ventilation, liver injury, myocardial injury, pneumothorax, rib fractures, spleen injury, sternal fracture, laceration related to the tip of the sternum, vomiting related to aspiration. Place victim on left side. Wipe vomit from mouth with fingers wrapped in a cloth. Reposition and resume CPR. Medical management: adrenaline. Epinephrine. It is the main drug used during resuscitation from cardiac arrest. Epinephrine as a single dose of 3 mg is sufficient to block vehicle tone completely and should be used once in cases of asystole. It is also indicated for asymptomatic bradycardia in a dose of 0.5 mg. 1 mg amiodarone. It is an antiarrhythmic drug. Nursing management: maintain airway patency with use of airway adjuncts as required. Suction, high-flow oxygen with O2 or bag mask ventilation. Assist with intubation and securing a VTT. Inserts gastric tube and/or facilitates gastric decompression. Post-incubation is required. Assist with ongoing management of airway patency and adequate supports less experienced staff by coaching for a guidance. Example: drug preparation. If shockable rhythm is present, VT/VT. Ensure manual defibrillator pads are applied and connected. If CPR is in progress, prepare and independently double-check and label 3 doses of adrenaline. Prepare and administer intravenous fluids. Document medications administered, including time points to remember. Assess the victim. Look, listen, feel, and if not breathing, call for help. Compression should be smooth, regular and uninterrupted. The pressure on the chest should be completely released after each compression. Although the palm of the hand remains in contact with the chest's wall, the xiphoid process should not compress because of the danger of lacerating the liver. Immediately start CPR. The victim should be stabilized before transportation to a more convenient site. The presence of a palpable carotid pulse and constriction of pupils are evidence of effective circulation and oxygenated blood. All staff is to be skillful at CPR. Ratio of cardiac compression to ventilation is 3:2. Compression rate equals 100 compression minute.